have the record in progress when they arrive. So I don't need to say to them like we are recording. Okay. Now,
Sure.
welcome to our virtual Saturday Research Academy conference. I'm going to let participants in.
All right.
Thank you.
Good morning, everyone.
Hi.
Good morning.
Morning, guys.
We are waiting for other participants to join us. So we are gonna stay here for at least one more minute.
Yes, one more minute.
Mhm.
Good morning, everyone.
Good morning. Welcome to our Virtual Research Saturday Academy conference. We're gonna have Dr. Pei Jane Tsai. Today also we have Dr. Aratia with us. So we need to wait at least 1 or 2 more minutes to let everyone go in to the conference because we have more participants that registered before. Thank you so much for being here.
Okay, thank you.
Hey, good morning, Darja. Darja, are you there? Darja? Yeah.
Good morning.
Dimitri, how are you doing? Yeah. Yes. Yeah. Darja and Dimitri are from Moscow, right?
Yes.
Oh, yeah, that's good. Nice to hear from you. Ekaterina, also she's from Moscow.
Hi, good morning, everyone. I'm Dr. Eva Sepulveda. I'm gonna be the moderator of this activity. So we have about 15 participants now, and we have more people joining us today. So welcome to our virtual Saturday Research Academy conference. We have here Dr. Aratia, who is going to give you a welcome to this activity.
Okay, good morning to everybody in this side of the world, and good afternoon to the student coming from Russia. All right. Yeah, today we had a professor from Taiwan, from the National Cheng-Kung University, and Professor Pei Jane. You see, she is an expert in biotechnology, and she is a Fulbright Visiting Scholar in the United States. Okay, she's going to go back to Taiwan.
I'm sorry, Dr. Aratia, you are on mute.
Okay, guys. So I'm sorry. Now I realize that I'm mute. Okay. Good morning, I say. We repeat. Good morning to everybody in this side of the world, and also good afternoon to the Russian audience. Okay, student and mentor. Yeah. Today we are lucky to have Professor Pei Jane at this conference. She is a professor at the National Cheng-Kung University in Taiwan, and she's going to talk about bacteriology. And she's an expert in biotechnology, really. So I thank her for the time to present whatever she's doing in the United States and also in Taiwan. She's a researcher, so it will be interesting for you guys, all the students, and just to get connected with this Fulbright Visiting Scholar. Okay, Professor Pei Jane, you can start your presentation.
Okay, thanks, Jen and Elba. And I'm Pei Jane from Taiwan, and I'm very happy to take this kind of opportunity to share the bacteriology knowledge with all of you. Yeah, and now I'm the Fulbright Scholar, visiting scholar in the Wake Forest in North Carolina. So I would like to share all of the problem in nowadays in this new area, especially in bacteriology, and what kind of technique that we can solve the major problem here. Okay, and I think I'm not sure. Okay. Okay.
Oh, can you? Yeah.
Okay. And I don't know how to do it. Yeah. And now I'm in the USA, North Carolina state, and I think part of our students is in Puerto Rico and Moscow, and I'm from Taiwan. Is overseas here, and it's almost 3 different part of Earth that put through this kind of conference put we together. Yeah, I very appreciate it. And what I do my faculty job is to separate my time into 2-3 different kind of area. One is for teaching, just like today. I would like to I teach a lot in clinical microbiology lecture, and especially in laboratory. And also I train student in the hospital, so we call it clinical internship. And I also do a lot of research part according to the bacterial pathogenesis. So I try to improve some kind of bacterial culture, also using in vitro and in vivo model to study bacterial infection. Besides of this kind of major duty, I also participate our hospital to help clinician to solve the bacterial culture and diagnosis. So now today I would like to share you that the major problem in this era, bacteriology in clinical is we face a lot of problem here. So I would like to share that I will not talk about a lot of how virulence or how toxic of the bacteria, but nowadays I would like to share you how kind of a technique that we can deal with this kind of pathogen. So my major research is focused on 2 pathogens. One is Streptococcus pyogenes, and the other one is Clostridioides difficile. I think the name of the bacteria is hard to pronounce and to remember, but I think the Streptococcus pyogenes is some kind of, many of us may infect it before or maybe after. It can cause a lot of, the severe one, it can cause impetigo, pharyngitis, and pharyngitis is the most common Streptococcus pyogenes infection symptom, and also cellulitis, toxin shock syndrome. But after we got this kind of bacterial infection, if we cannot cure it very clean, and later on, we might go to, the patient will go to a kind of autoimmune disease just because this bacteria cell wall component, some kind of cell component on this bacteria has some kind of homolog or some kind of mimic protein to our heart tissue. So it also causes autoimmune disease such as acute rheumatic fevers. And the most severe one for the severe symptom for this bacteria is kind of skin infection that causes the necrotizing fasciitis. So this is why in Taiwan, we very focus on this bacteria and try to identify the pathogenesis and using animal model to looking for new therapeutic drug. But I think in US we find I found a lot of the drug or the treatment on the shell that also treat the sore throat. This is what I would like to remind you. What I do is focus on this bacteria, and this bacteria usually cause pharyngitis, and the pharyngitis we another name, a common name, we call it sore throat, and it a lot of commercial drug that can treat the symptom, but not directly to the bacteria. In another word, in another one is Clostridium difficile, and this is the anaerobic bacilli, and it always form dormant in the environment in a spore forming spore form. So it is very hard to eliminate from the environment. So even we use the alcohol, it cannot disrupt the spore. So it is very important issue in the nosocomial infection and in the hospital. So nosocomial infection is a term that means you got infection, especially in the hospital, and not from the outside of the community. So this is after you went to the hospital, and when the patient hospitalized and infected this kind of bacteria in the hospital, this is what we call nosocomial infection. And this bacteria is very important now because after patient hospitalized, maybe they got some kind different kind of infection, or the patient was undergoing the surgery. The doctor will give the patient antibiotic, and after antibiotic treatment, our gut microbiota will disrupt, and this kind of bacteria will burst, will grow, and produce toxin and induce a kind of diarrhea. So we call this kind of syndrome is after antibiotic treatment. So this kind of diarrhea we call antibiotic associated diarrhea. So how to treat this kind of bacterial infection is to stop using antibiotic. It's very different kind of concept to treating bacteria. We always think treating bacteria is using antibiotic, but in Clostridium difficile infection, especially in antibiotic associated diarrhea, it is not using this way. So we have to stop using antibiotic and regenerate our gut microbiota, and then we'll try to eliminate the Clostridium difficile by another antibiotic. And it also causes toxic megacolon and pseudomembrane colitis. So the new technique for treating Clostridium difficile is kind of alternative strategy. We do not using antibiotic, but we use the healthy fecal content. Is called fecal transplant therapy. That's using a healthy donor, provide the fecal content, and we inject or oral through the oral route to rebuild our gut microbiota to prevent Clostridium difficile infection. Also, this kind of treatment, we also call it fecal microbiota transplant, FMT. So I think these two pathogens I focus on my research nowadays is the most important thing I would like to share with you is like this. But back to today's topic, we would like to encourage students that in 2021, last month, a report that told that report that microbiology testing, especially in clinical microbiology, is growing very fast. So if everyone has are interested in microbiology, I think there are lots of job opportunity for you to participate, especially in the lots of bio company, especially in microbiology testing is Biomaris, Alere, and Brookers. And what they do, what kind of microbiology testing are they focused on? All we are looking for is according to the how to isolate or identify the bacteria as quick as we can, and how can we identify or how can we block the drug resistant based on our identification for the drug susceptibility. And in another way, nowadays lots of next generation sequencing technique was burst. So the microbiota is also an important area that microbiologists are focused on. And also this slide I mentioned that Clostridium difficile that can using the fecal transplant, and what kind of fecal is healthy or good for our health. We can through this kind of a technique to solve this kind of problem. So microbiota area is also an important area that we can jump in. And the last one I would like to share you today is also called AI, artificial intelligence. AI that help us to not think too much. We let computers think. So in microbiology testing, we use a lot of tests through the microscope. Yeah, and using microscope, we see the bacterial morphology and differentiate with different kind of staining. But this kind of looking in the microscope is based on our experiments and experience. So if we can train computer to look at the morphology and help us to differentiate what is gram-positive bacteria or what is cocci or what is bacilli, and this will help the technician a lot. So AI is a new technology that microbiology testing is very focused on. In the following talk, I will discuss this part. So back to the 80s, I think clinical bacteriology is quite different from now on. And at the very beginning, I think we know that after the microscope was developed, and we can see the microbe through the microscope, and after that, using different kind of staining, we can differentiate the bacteria. And what is we called clinical bacteriology or clinical microbiology is the method we use to collect clinical sample, and we report the result to the validity of the result to tell the doctor what kind of etiology or of the etiology of the disease, what kind of organism is involved in the disease. So after we know what kind of method, I'm sorry. So what kind of method we use is to know what the bacterial property. So after we use different kind of biochemical culture system, we can know what kind of bacterial organism is. So after 1950s, we use lots of tube and petri dish and culture to know what kind of bacteria it is. And after 1980s, we get smarter and to minimize the test tube into the small strip, and from the volume 10 or 20 milliliter to 1 milliliter. And after that, we can try to identify the bacteria using different kind of biochemistry testing in a single strip. And we know what, with this different testing, we can know what kind of bacteria it is. And after 20s, we smaller this kind of commercial system to just like our credit card size, and we can put the very tiny volume bacteria in very tiny single reaction volume, and we just put into the auto machine, and it can read out after 24 hours. But today, I would like to share the new tech is we use nowadays, our hospital use the multi-top mass spectrum to identify bacteria. It's very, very quick. So identify or finding pathogen is not enough. Nowadays, we need quick method as soon as possible, and after that, we can cure a patient with specific antibiotic. So the traditional way, we collect a clinical sample from different sites, even urine, stool, body fluid, or blood, and we culture it to see whether the clinical sample contains the bacteria or not. And after we cultured, we know it is there are microbiology or bacteria in the specimen, and after culture that we have to identify. So we use lots of method, including staining, and we have to differentiate what kind of bacteria through the staining method, and using different kind of biochemistry to testing, including large size, small size, or tiny small size. And we also can use the molecular biology and to identify specific marker for the bacteria, and that we can know specifically what kind of bacteria it is. But this take us maybe 1 to 4 days to know the answer. And after that, we also have to do the antibiotic susceptibility test and to know what kind of bacteria and what kind of antibiotic can kill and can inhibit bacterial growth. If we inhibit bacterial growth, we can see the clear zone here. If this kind of antibiotic cannot inhibit bacterial growth, it will look like this. The bacterial zone will grow all over the plate. But now I would like to show you that is the mass spectrum analysis. This kind of technique can increase the shorten the identification period that from days to hours, and after 1 or 2 hours, we can know the bacteria, what kind of bacteria inside our clinical sample. And what is multi-top mass spectrum? And this kind of system is we can put bacteria after we culture the bacteria, and we can put the bacterial colony on the multi-target, and we add on some kind of matrix, is also acid or other organic solvent. It can crystallize this the bacteria, and later on, using the high energy laser that can dissolved and ionized by this kind of energy, laser energy, and later on we use the electron field and different kind of crystallize the ionization protein or lipid will separate it by the electric field, and therefore the detector can detect in different time. So we call it time of flight analyzer. And after that, we can get a lot of information. We call it bacterial fingerprints, and each kind of bacteria has different fingerprint. So therefore, we have the bio company build a library that we can use when we got a fingerprint. We can, and the computer can compare it or look for their database and tell us what kind of bacteria it is. So multi-top mass help us a lot to solve the identification problem. But now I would like to share with you if we can improve more identification period, the cultural time, we can improve a lot, because when we got the clinical sample, we have to culture it, and when it grows, when colony grows, bacteria grows, and then we finally can use the multi-top. But if we can directly concentrate the bacteria, the small amount of bacteria directly from the clinical sample, that we can increase the shorten the time period and directly put on the multi-target. And this area is nowadays in 21st century, we try to improve our technique in this kind of area, and this kind of technology, we think nanotechnology will help us a lot in this area, in this kind of concentration, the bacteria directly in the clinical sample. And also multi-TOF also solve a problem according to the long-term cultural pathogen, including Mycobacteria tuberculosis. It also improve the time periods a lot. And but also, this kind of technique also has kind of limitation because after culture we can identify the bacteria one by one colony by one colony and one answer. And the limitation is if the bacteria is mixed, this is a mixed infection, we cannot through the this kind of library database to identify 2 or 3 pathogens at once. So this is also a limitation in this kind of technology. So after we know the multi-TOF is a good technique for us to quick identify pathogen. So now I would like to remind all of us that still have a lot of bacterial problem all over the world, not only COVID-19. We have a lot of antimicrobial resistance rate, especially the C. diff, MRSA, or Neisseria, and also E. coli driven the foodborne diarrhea and other some kind of anthrax, bioterrorism. And I think some of us comes from Moscow. I think the E. coli still a highly concerned problem there. And I'm in North Carolina, and here still have some kind of a Western Nile virus infection problem. And also in Puerto Rico, the chikungunya is also this kind of virus infection is also these 2 kinds of comes from the virus infection, and these 2 kinds of virus is mediated through the vector. So I think today I will go back to discuss more about bacteria. And I think bacterial infection nowadays more important is according to the antibiotic resistance. So drug resistance driven us to take more attention to it, and we call this kind of bacteria superbug. And with the what is the superbug means? It means the bacteria with highly drug resistance. And this is antibiotic resistance is a global causing a global threat, not just because the bacteria is very virulent to our host body, is even it is a common infection, but due to the we don't have enough antibiotic or good antibiotic to treat the patient. So in not only Europe, India, Thailand, United States, all over the world are facing this kind of problem. So how to causing the antibiotic resistant bacteria is based on overprescribed antibiotic from the doctor, or we didn't take the medicine as prescribed, or unnecessary using antibiotic on our environment or agriculture, and also poor infection control in the hospital, or our poor hygiene, or like the last one is if we cannot rapid diagnose in our laboratory, we cannot provide good treatment in our hospital or to treat patient. So now we are trying to solve this problem with different kind of infection control in the hospital, and we try to identify pathogen as quick as possible, and then we identify what kind of antibiotic that we can efficiently cure the bacteria infection. And then we can use that as less as we can to use less antibiotic in our hospital. Nowadays, I think the superbug we have to know is this 6th type. Is very, very emergent one. One is the carbapenem-resistant Enterobacteriaceae, including E. coli, Klebsiella pneumonia, and this kind of bacteria, Enterobacteriaceae is also in our gut, normal flora in our gut, and when they become resistance to carbapenem resistance, it will be very dangerous after the patient have the surgery. It can cause the bacteremia, or we have not enough antibiotic to treat. And the other one is methicillin-resistant Staphylococcus aureus, we also call MRSA. This kind of bacteria is community acquired, so it is very important for all of us to take care of our community. It is spreading out in the community. So I think this is a very important issue to take we have to take care. And the other one, and the third one is the Neisseria gonorrhea. It causes the sex-transmitted disease, and when people got sex-transmitted disease, they are not very happy to see the doctor, so they might take a lot of medicine by themselves. So Neisseria gonorrhea kind of driving, and this is the driving force to cause the Neisseria gonorrhea becoming highly drug resistant in the in patient. And the other superbug is Acinetobacteria baumannii. This is not a very virulent bacteria, but it can uptake a lot of antibiotic resistant gene. So this kind of bacteria is also hard to treat. And also the bacteria I'm dealing with is Clostridioides difficile, and it's caused by antibiotic associated diarrhea. And also E. coli, which also cause foodborne diarrhea. So that is a single pathogen that we can identify, and we know the antibiotic susceptibility. And next technique is very important to help us know more bacteria. And this is we call next generation sequencing, that we can know a lot of bacteria or identify a lot of bacteria at once, at single reaction. So we call it microbiota, or we will use this kind of technique to know a single bacteria whole genome sequencing based on this kind of the sequencing technique. So when we know, when we got the clinical sample, we can collect the DNA from it and digest. And after that, we can add on some adapter, and later we can use the sequencing to see whether what kind of bacteria was infected our body. And this is can use look for different kind of mixed infection. So multi-genome is the benefit of this kind of technology. And there is a good book to read, written by Elena Collin, and we are just 10% human, and 90% is microbiology. So nowadays we know that a lot of gut microbiota altered our health according to such as metabolic disease, IBD, or alter our immune system. Therefore, probiotic is an emerging area that what kind of good bacteria can provide or alter our health to become a better one. So there are lots of probiotic have been identified, and I think most of them, most of you must know that probiotic. But I would like to share with you is nowadays we also know another population we call next generation probiotics. This is based on the technique we NGS. After NGS, we know a lot of bacterial name, and even before that, before NGS development, we didn't know the bacteria, and this kind of bacteria is good for us. So we call that they are next generation probiotic, such as Akkermansia, and this bacteria, many people say that it can reduce our body fat, so it can help us become more thin, or good health for us. And the last one I would like to share with you is artificial intelligence. And this kind of technology will alter our vision technique, and we educate the computer with different kind of bacteria with the grandstand, and we use the unknown sample to test the computer, and we do some kind of refinement. And nowadays we use this kind of technique in our hospital to solve the to reduce the loading for our eyes to identify bacteria on the smear. So the last one, I would like to remind all of you that One Health is very important in bacteriology in 20th century because our human is connected with animal and environment. If we treat, we got lots of antibiotic resistant strain from the animal or the environment. So if we treat this environment or animal well, our human being will have better life. So the microbiology, even though. So today, the take-home message is in the isolation and identification in microbiology, I introduce all of you about using the multi-toph, and we have to take care a lot of drug resistant idea. And later on, I introduced the NGS, and we found a probiotic area is also very important to still need to dig in. And the last part, AI is a new system that we can apply it in identify image, help our eyes to differentiate bacteria in different staining. And later on, I would like to share with you that One Health is very important. So not to destroy or through the antibiotic, withdraw your antibiotic in the garbage. We have to package or destroy with tea or coffee, and inactivate the antibiotic, and then we destroy or in the waste. So we cannot just without caution to disrupt or without caution and disrupt and put the antibiotic away. So we have to protect our environment with very careful. So I think this is my talk. I went out of some kind of time, I'm sorry. And I'm very happy to take any questions here. Okay.
All right. Thank you very much, Dr. Pei Jane.
Thanks.
Yes, Elba, are you there?
Yes, I'm here.
Can we take, before take the question, take a picture of all the attendants? So
Right.
probably I will ask the attendants to open their screen so we can see their faces, and we are going to disseminate this. All right. Thank you much, guys. Thank you much. I really appreciate that. So as soon as we have all the people with their faces there, we don't have too many. All right. Okay. Can we have almost all of them? Darka, can you? All right. Darka still there. Brian, Marisol, Excel. Yeah. All right. Adrian, Gerardo, can you please open your Eva? Alice, Jorge, Gabriela, Dimitri, Eva. Yeah, Dimitri, Luis, Gabriela, perdón, Natalia. And we would like to see the faces. This is for the reporting, okay? It's not for any, just as an official report that we had to get to the citizen diplomacy, all right? So, okay, I think we had enough. All right, now is the time, Elba. Yes, good, thank you. Okay, now the questions. Yeah, it's a very interesting one. I had a few questions, but I will let the student and the attendants to ask questions, right? It's a very interesting topic. And so, do we have questions? No questions?
Hey,
Yes? Eva, you have questions?
no, sorry.
No? Okay.
Well,
Anybody? Yes. Angel, you have questions? Angel Arcelay?
No.
No?
thank you so much, Dr. Pei Jane, for your conference. I think we've learned a lot about clinical bacteriology and all the things that you do there. It caught my attention that now we are using a lot of emerging technology for helping hospitals, patients, and doctors to be able to identify those bacteria. Can you tell us about that process when you identify that? What happened with that? What after you identify your bacteria?
Oh, after we identify what the pathogen or bacteria was in the clinical sample, and we report it. And the most important thing, not only report the bacterial name, we have to report the antibiotic susceptibility test result and tell doctor that what kind of antibiotic can be used to eliminate the bacteria. And after that, the doctor will decide to use the antibiotic to treat the patient. Yeah. So the most important thing is we have to report what kind of drug or antibiotic that the doctor can use to treat patient. Mm-hmm.
Thanks.
But the antibiotic susceptibility is very important based on what kind of bacteria we identified. So we have to identify bacteria first and know what kind of panel of the antibiotic we can testing, and then report the antibiotic susceptibility test result. Mhm.
All right.
Thank you.
Kevin.
Thank you so much. Another thing that I want to note is that computer is a necessary tool for identify that quickly. And I know that we have a lot of students here on the audience that they are, interested in this particular topic, so they can contact you. You can give us like an email or something that we can use to contact you.
Mhm.
And you can put that on the chat if you can.
Okay.
Also,
sure.
I want to thanks to you for all you do to assist doctors. I have a question here. Beatriz Muniz wants to.
Yes.
Okay.
I have a question that I had seen somebody else post, and I found it very interesting. The question that she asked was, how do we discard old antibiotics safely?
Yeah. It's very important. I like this question because in our country we have a kind of pharmacy that can collect the unused or the preservation date is passed, and we can collect the unused antibiotic in the pharmacy, and we collect all the antibiotic and destroyed it by inactivation the antibiotic function with some. But when we are at home, we can do is to use coffee or tea to inactivate some kind of antioxidant to inactivate the antibiotic function, and then we can destroy it. Yeah. At home we can do that. And
Yes.
or government has some kind of policy. We in Taiwan, the government had policy. We have to send the antibiotic back to the pharmacy, and they will collect it, centralize and destroy it. Yeah.
Can I
Thank
ask
you.
you another question very quickly?
Yes.
It's
Yes,
about
sure.
the best way to keep our environments clean. What type of disinfectant would you recommend?
Well,
There's so many out there in the market. There's so many, which one's
yeah.
preferred?
Yeah. So the best way I used is kind of not use the chemical way, is kind of the disrupt the membrane, the hypotonic way. So I think alcohol is the best way to use in disrupt the bacteria or pathogen. Yeah, I think alcohol is the best way, but we also have some kind of hypochloronic acid. We call it hypochloronic acid is also is another way. The hypochloronic acid is made by sodium chloride with the ionization technique to separate it, and it is better than Clorox without the smell, and will not disrupt our skin. So it will be better for use in disinfection for our environment. But by the way, I would like to say that hypochloronic acid also disrupt the Clostridioides spore. So we use it a lot. Yes.
All right.
Personally, yeah.
Hey, Kevin, are you there? Kevin, do you have any comment? Kevin Morales.
Yes, doctor. Hi.
Yeah, great. Kevin is an MD. Okay, he's from Nicaragua.
Hi.
Yes. Yes. Got any comment?
Thanks. I have a question. How do we prevent bacterial resistance with current technology? How do we prevent bacterial resistance with current technology?
Excuse me, what kind of
He's asking about the resistance of the
resistance.
bacteria. Yes, resistance.
Okay, I got it. So what kind of technology we use to increase to identify bacterial resistance, drug resistance in bacteria? And nowadays we use the old way, the traditional way to put the antibiotic on the disc and use the disc to put onto the bacterial agar plate and to look for the bacterial growth or not. So it's kind of a traditional way to test antibiotic resistance. But I think it is the phenotype analysis. But now there are lots of drug resistant gene was identified. So if we are dealing with very hard treated infection, we might using the molecular biology, using the PCR to directly identify the drug resistant gene from the clinical sample. So that is also we are doing in our hospital, but it costs a lot. So we always using the traditional way to identify drug resistance. But so you mentioned this problem. We also there are the bio company also trying to improve this process by using multi-TOF. So multi-TOF, even it can based on the rationale, the multi-TOF can identify bacteria from the bacterial fingerprint. But we can when the bacteria was treated with specific antibiotic, the profile will change. So we are the bio company is trying to identify whether drug susceptible or antibiotic sensitive bacteria and comparison with antibiotic sensitive one or antibiotic resistant one with the treating specific antibiotic and looking for the difference on the multi-TOF profile. And we can differentiate whether this bacteria is sensitive to this drug or resistant to this drug. So they are trying to building this kind of database in their multi-TOF library. Yeah. So did I answer your question?
Yes, thanks. What technology can we use to kill bacteria in work areas? What technology can we use to kill bacteria in work areas?
You mean what technology we use?
He's asking about what kind of technology are you using right now to kill bacteria
kill
bacteria.
Different way. In our laboratory, we use I have mentioned that hypochlororic acid and alcohol to disinfection our environment, but it cannot be used for treatment. But in different kind of bacterial infection, we use different kind of antibiotic. So especially if you mentioned that the Clostridium this difficile, now even vancomycin is the most potent drug to treat Clostridium difficile, but fidaxomicin is also another new antibiotic with narrow spectrum to treat Clostridium difficile. Yeah, but in our hands, we trying to use different kind of good or minor or third the antibiotic that are not broad spectrum that will cause the whole gut microbiota balance. We use the narrow spectrum antibiotic to look for whether if we alter the gut microbiota less, and we can inhibit the Clostridium difficile more. So it's kind of balance for the antibiotic treatment. So in Clostridium difficile induced diarrhea, we try to identify narrow spectrum antibiotic that we can use to inhibit Clostridium and not to alter that microbiota too much. Yeah, so lots of antibiotics are trying now in our clinic.
Thank you so much, Dr. Pei Jane, for your answers and all for all the questions. They are excellent questions. Your research seems to be very beneficial to all. We need to collect some information about the participants. Thanks for filling the survey for us. And if you still have more questions, I think that we can stay for 3 or 4 minutes more here, so you can answer and you can have answers for your questions. Okay, please use the links to fill out the surveys and the conference feedback. Thank you so much for being here. Dr. Aratia, do you want to say something more?
Yes, I really would like to thank the speaker for the very interesting talk, and also the communication with the participant. Yes, I think we will talk after we finish with this conference, and but this is really what we would like to do in terms of student. If the student would like to go to Taiwan, for instance, I think we are going to arrange some kind of internship, okay, in this particular topic, and that's something that we are going to discuss. But that will be available just to all the students, okay, that their major is in biological science. Thank you very much.
Thank you.
Yes.
Sure.
We have people here from Dominican Republic, from Puerto Rico, Russia, from US, Virgin Islands, and Nicaragua. Thank you so much for being here and to help us having this activity good for all. Please give us feedback. We appreciate all you do. We appreciate that our speaker is sharing a lot of information of what they are doing in hospitals and different places. Thank you all for your participation. And as I said before, if you have questions, you can stay longer, but I will, appreciate that you also come here December 11th for another conference. I have also Dr. Leonid Satov that he wants to talk. So you're welcome to talk.
Hello.
Leonid.
Hi.
Hello, hello, Leonid.
I can use Chinese.
Oh, really?
您的报告很有意思，谢
谢谢。
莫斯科大学的教授想问问题。I want to ask, during our contemporary epidemic of corona, usually people have treatment using antibiotics. So it's like an accompany for treatment prescriptions. Do you expect that there will be consequences for this, how to say, wide use of antibiotics today? Will there be extent of resistance of bacteria?
Yeah. So you mean after so how can we use antibiotic well and to prevent antibiotic resistance?
Yeah, what's your opinion about this?
But yeah, it's kind of two sides of the sword. Yeah. So I think using the antibiotic precisely, and so we have to the doctor have to wait what kind of antibiotic is efficient to treat the infected bacteria, and only use that kind of bacteria, not with any kind of just their experience to treat the symptom. They have to choose what kind of actually what kind of antibiotic can inhibit bacterial growth. So they can use that kind of antibiotic only. And in the patient part, I think with the how and the bacteria and the antibiotic, the prescribed drug, how long we have to take, or how the frequency or the period. I think it is important. We have to follow it. So that prevents the bacteria become an antibiotic resistance. Yeah.
Yes, but my issue is that when I had coronavirus, that's the first thing they prescribed, antibiotics. I know that antibiotics are not efficient against viruses, but they prescribe it to everybody who is infected with corona. That's my issue I'm asking.
Okay, I got it. So you mean after the virus infection, but the doctor give you the prescribed antibiotic? Yeah.
Yes.
Yeah. It's very hard to correct the experience using drug medication of the doctor, but I know part of the doctor think that the antibiotic not only inhibit bacterial growth, but also altered our immunity to activate our immunity against the virus. So part of the doctor would like to use this kind of treatment, yes. But in my opinion, I don't take antibiotic a lot. Yeah.
Me neither.
Okay, thank you. But by the way, I would like to say that but the influenza virus infection is always comes with bacterial infection. So this is another kind of the doctor would like to treat pneumonia or some kind of respiratory virus infection combined with antibiotic. Yeah, this is what they think.
Great questions. Thank you so much for your participation. I put the verification of attendance certificate. Please take a screenshot so so we can, have a proof that you were here. Okay.
Yeah.
Thank you so much, and see you next week.
Okay.
Bye.
Dr. Pei Jane, yeah, I
Yes.
would like to talk a little bit about the possibility. You see, I have here Dr. Kevin Morales. He is from Nicaragua, and we had a group of students who are MDs, okay, medical doctors. Okay, he is the medical doctor, but we had other students who are MD first year, second year, third year, and we would like for them probably just to have the opportunity to go to your place in Taiwan. And
Yeah.
So how can we do that? It can be a summer opportunity, just looking for the future, okay? A summer opportunity, because that's what we normally do, 1 or 2 months during the summer. That would be a good experience because they are learning how to do research. all right?
So
Right,
they
right.
come to Taiwan to do the research or the lab in the lab or in the clinic. In
Well,
the
it can
lab.
be, can be anyone,
Oh,
anyone that you really can offer. You see, anything you can offer. Yes, because they already have some project going on. I work with Dr. Kevin Morales. He is the mentor of the student in Nicaragua. So they are progressing. You see, because they are new in research. The curriculum in MD in Nicaragua, it doesn't have any research orientation, but we are starting one, right? And so the students are learning how to do it and how to practice research, okay, in medicine, okay?
Yeah.
So that's what, since your lab is really advanced, really in this particular area, we would like to, some of them just would like to go to Taiwan, for instance. I understand that Taiwan and Nicaragua, they have pretty good relation in terms of exchange, okay? Exchange student. And many students from Nicaragua go actually to Taiwan to do studies at the university and postgraduate studies, okay?
Okay.
So maybe we can do something with this particular group. Those are Nicaraguan per se. Okay.
Okay.
I do have a student here in Puerto Rico and also in the Dominican Republic, and probably other. I'm not Leonid. Maybe they have some other student who would be interested just in doing a summer program. Okay. So I'm not sure if that's feasible or not.
Yeah, I think basically in my lab, I'm very welcome many doctor. We have a lot of doctor collaborate with us, and they are trying. And I also have doctor PhD student.
Yes.
So I think we are very welcome. The doctor research training in my lab. But I'm not sure the exchange program or other kind of support from our side to help the exchange student in our university. This will, I need to ask them how to help students when they came to Taiwan in our school. Or we can initiate some kind of MOU to help student exchange and support their expand.
Yes, I think that would be a good idea, just to have an MOU, because we work there with the university, the Catholic University of Nicaragua, okay? They are based, and actually Dr. Kevin Morales, he's a professor there, okay? He's teaching actually research, introduction to research program, and we are doing that's the group we have, okay? And so it will be interesting, so we can just be in contact, and we can just put together some kind of MOU with the institutions, and that would be really interesting. All right.
Yeah. So if we have that kind of MOU, that therefore student can come to Taiwan easily and stay there with some kind of support and come to my lab. My lab is always welcome to students to learn what they want. Yeah. And I have to mention one thing that.
Thank you very much.
Yeah, I have to mention one thing that because based on the COVID, Taiwan has a very restrict the regulation for the immigration or I mean when we back to Taiwan, we have to quarantine for 2 weeks. Yeah, it's take a long time.
No, I'm talking about probably in the next summer or the next year. You see, I hope
we stop that.
out of the scene,
Yeah,
right?
yeah.
And we can do
Mhm.
something normal. Yeah,
Okay.
because the other area where we do things is virtually. You see, we have actually the program I have in Nicaragua is virtual program. Okay,
Mhm.
actually the student there, we don't meet them face to face. It's a virtual program. Okay,
Mhm.
yeah,
Mhm.
and actually, and visually has been working probably well. You see, with some students, really.
Mhm.
So that will be another option if COVID still in China and Taiwan. Yeah, I do have also relation with mainland China. Okay,
Mhm.
had other colleagues there, and
Mhm.
they are telling me, yeah, they're pretty tough in terms of regulations and movement and everything. Yeah, I think they take it very seriously. The coronavirus, they take it very seriously. So, and that's good, really. I I like that because they want to control that. Okay,
Mhm.
and controlling, you have to take care of everybody who is coming in or go out. Okay,
Mhm.
the country. So I understand that limitation. All right.
Mhm.
I, yeah, we can do something for the normal time. Okay, when we
Okay.
can go there without quarantine. I'm sorry,
Yeah.
quarantine,
Yeah.
and I guess and a student can just meet other people, and
Yeah.
that's good.
Yeah.
All right. So I
Okay.
wish you, because you are returning to Taiwan early in 2002, right?
Yeah.
Yeah.
Next year. Mhm.
Next year, right?
Yeah.
Yeah. Okay. Thank you very much again for
Thank
being
you.
so kind and
Mhm.
presenting us a very interesting presentation. Okay.
Thank you.
Take care.
Thanks for
Bye-bye.
your invitation. Yeah. Thanks.
Bye-bye.
Mhm.
Take care.
Bye bye.
Remember to fill the survey. Please do not go, Dr. Pei Jane,
Uh-huh.
so we can stay just to share with you what the participants said